Did you know that the U.S. has reported over 30,000 cases of monkeypox this year alone? It's raising alarms everywhere, and many are wondering, could monkeypox be the next pandemic threat? Stick with me, and we'll break down exactly why America needs to pay attention before it's too late. So, what exactly is monkeypox, and why is it making headlines now? First discovered in 1958, monkeypox has typically been found in parts of Central and West Africa, but in recent years it's jumped continents and is now posing a real public health concern in places like the US and Europe. This disease, though not new, is hitting new territories, and in the wake of COVID-19, we're seeing how fast things can spiral out of control. And it's not just about the numbers. Health experts are particularly concerned because this virus is affecting people in ways we haven't seen before. We need to talk about its symptoms, how it spreads, and what's being done to stop it. Let's break down the biggest challenges monkeypox presents. First, the symptoms. Monkeypox typically begins with fever, chills, headaches, and muscle aches, kind of like the flu. But here's where things get more serious. After a few days, a distinctive rash develops. It often starts on the face and then spreads to other parts of the body, including the hands, feet, and even inside the mouth. These rashes progress into raised bumps that fill with fluid and can be extremely painful. Now, monkeypox spreads primarily through close physical contact. That includes things like skin-to-skin contact, touching contaminated objects, or even prolonged face-to-face exposure where respiratory droplets can transmit the virus. In some cases, it's even been found to spread through intimate contact, leading to clusters of cases in certain communities. One of the biggest fears health professionals have is how this could strain healthcare systems, especially in areas where resources are already limited. Think about it. Our healthcare workers are still reeling from the COVID-19 pandemic. Adding monkeypox into the mix could result in staffing shortages, overburdened hospitals, and potentially delayed care for other medical needs. When you look at the bigger picture, the stakes are high. History of monkeypox and comparisons to COVID-19. To better understand why monkeypox is such a big deal right now, let's go back to where it all began. Monkeypox was first discovered in laboratory monkeys, which is how it got its name, but it's actually more common in rodents. Since the 1970s, most of the cases have been reported in rural parts of Africa, particularly in the Democratic Republic of Congo. It remained relatively contained there, but outbreaks in the last few years show it's no longer staying within those borders. In 2003, the U.S. saw its first outbreak of monkeypox, linked to pet prairie dogs that had been in contact with infected animals imported from Ghana. Luckily, it didn't spread widely then, but the situation today is different. With international travel and global connectivity at an all-time high, diseases like monkeypox can spread rapidly. Now, people are asking, is this another COVID-19? The answer is no, but it's still concerning. While COVID-19 spreads primarily through the air and is highly contagious, monkeypox spreads more slowly and requires closer contact. But that doesn't mean we can let our guard down. COVID-19 taught us how quickly things can escalate, and monkeypox, while different, still poses a serious risk. Unlike COVID-19, monkeypox has a lower mortality rate, around 1% to 10%, depending on the strain. But even though it's less deadly, it can cause serious complications, particularly in immunocompromised individuals and those with underlying health conditions. The challenge is that while COVID-19 vaccines were developed at an unprecedented speed, monkeypox vaccines already exist, but they're not as widely available. The smallpox vaccine is about 85% effective against monkeypox, but distribution has been slow. Health experts from the CDC and WHO have been clear. Vigilance is key. Dr. Rochelle Walensky, director of the CDC, has emphasized the importance of vaccinating high-risk groups, particularly those who have been in contact with confirmed cases. In addition to vaccination, public health officials are working to raise awareness about how the virus spreads and how people can protect themselves. One thing we need to focus on is education. Public health messaging around monkeypox needs to be clear, accessible, and frequent. Too often, we see misinformation spread faster than facts, especially on social media. There's already confusion around monkeypox, with some people downplaying its risks or not taking the necessary precautions. To curb the spread, the CDC recommends the smallpox vaccine, particularly the Jynneos vaccine, which has been shown to be effective against monkeypox. However, the rollout of vaccines has faced hurdles, particularly with supply shortages and distribution issues. This is a reminder that global supply chains and health systems are still recovering from the disruptions caused by the COVID-19 pandemic. On the treatment side, antiviral drugs like tecovirimat TPOXX have been approved for use in monkeypox cases. It was originally developed for smallpox, but because of the similarities between the two viruses, it's being used in severe monkeypox cases. Still, access to these treatments is limited, and the focus remains on prevention rather than cure. Current developments and government response. So, where do we stand now? As of late October, new monkeypox cases are being reported across various U.S. states, and health authorities are working overtime to contain the spread. The federal government has activated emergency response protocols, and vaccine distribution efforts have ramped up. But the process is far from perfect. In places like New York, California, and Illinois, states with some of the highest case counts, health departments are partnering with community organizations to target at-risk populations. But even with these efforts, challenges remain. Some experts worry that the stigma surrounding monkeypox, especially since many early cases were identified among men who have sex with men, could hinder prevention efforts. It's important to stress that monkeypox doesn't discriminate. It can infect anyone, regardless of gender or sexual orientation. At the same time, the federal government has released millions of dollars in funding to boost state-level responses, focusing on increasing vaccine production, treatment access, and public education campaigns. But with winter approaching and more indoor gatherings, the risk of transmission could increase. But here's the thing. Preparedness is key. Just like with COVID-19, the faster we act, the better we can prevent a full-blown crisis. We've learned that waiting too long to respond can have devastating consequences. So, stay informed, take precautions, and let's work together to stop the spread of monkeypox. Now I want to hear from you. What do you think? Is enough being done to stop monkeypox? Do you feel prepared? Or are there things you're still worried about? Let me know your thoughts in the comments below. And if you're interested in learning more about how to stay safe during potential health emergencies, make sure to check out my video on pandemic preparedness. Thanks for watching, and stay safe out there.